Imagine you're standing with someone and suddenly they collapse right in front of you. For a moment, you panic. You don't know what to do. Should you give them water? Should you slap them? Should you sit them up? The truth is, those first few moments matter, and knowing what to do could help keep that person safe. So if someone suddenly faints in front of you, here's what you should do first. If someone suddenly collapses and you suspect they've fainted, here's the first step you should take. First, stay calm and check if the person responds. Go close to them and gently call their name. You can ask, "Can you hear me?" or "Are you okay?" You can also gently tap their shoulder. The goal here is simply to find out if they're conscious. Do not slap them, shake them violently, or pour water on their face if they respond. Ask how they're feeling and keep them lying down. Don't rush to help them stand up, because they may still feel weak or faint again. But if they don't respond, don't waste time trying to give them water, food, or medicine. Move to the next step. Check if they are breathing normally. Look at their chest and watch to see if it's rising and falling normally. You can also listen and feel for normal breathing. Don't assume that someone is breathing just because. They're making occasional strange sounds. Gasping or irregular breaths are not normal breathing. If the person is not breathing normally, this is no longer something to simply watch and wait for. You need to call your local emergency service and get urgent medical help immediately. If you know CPR and are able to perform it, begin according to your training. If they are breathing normally, keep monitoring them and move on to the next step. Get emergency help if they aren't breathing normally. Call for emergency medical help immediately if other people are around. Point to someone and tell them specifically to make them. Call or get an automated external defibrillator if one is available. If you are trained in CPR, start CPR and follow the instructions of the emergency. Dispatch you if you're on the phone. Don't leave the person alone just to search for water, food, or medication. The priority at this point is getting emergency help and supporting their breathing and circulation. And remember, even if you initially thought the person had simply fainted, an unresponsive person who isn't breathing normally may have much more serious problem. If they are breathing, keep them safe. If they are breathing normally but remain unconscious, place them in the recovery position if appropriate, especially if you need to keep their airway clear. This means carefully turning them onto their side while keeping the airway open. It can help prevent the tongue or fluid such as vomit from blocking the airway. Continue watching their breathing until they wake up or medical help arrives. And don't assume everything is fine simply because they're breathing. If someone remains unconscious, they still need urgent medical assessment. Don't give them food or water while they're unconscious. One common mistake people make when someone faints is trying to give them water, food, or medicine immediately. Don't put anything in the mouth of someone who is unconscious or not fully alert. They may not be able to swallow properly, and this can cause choking or aspirations. Instead, keep them safe, monitor their breathing, and wait until they're fully awake and able to swallow normally. Once they're awake and alert, you can calmly ask how they're feeling and help them recover without rushing them back to their feet. Don't rush them to stand up. When the person finally wakes up, don't immediately pull them to their feet. Even if they say they feel fine, they may still be weak, dizzy, or confused for a short while. Help them remain lying down or sit up slowly, depending on how they're feeling. Give them some time to recover and stay with them. If they try to stand too quickly, they could become dizzy again and faint for a second time. Once they're feeling better, help them get up gradually and make sure they have something stable to hold on to. And if they continue to feel unwell, become confused, have chest pain, difficulty breathing, severe headache, weakness, or faint again, they need medical attention. Find out what happened before they fainted. Once the person is fully awake and able to talk, gently ask them what happened before they lost consciousness. Did they feel dizzy? Were they extremely hot? Had they been standing for a long time? Had they eaten recently? Were they feeling unwell or in pain? These details can be important because fainting can happen for different reasons. It may be related to things like dehydration, overheating, emotional stress, prolonged standing, or a sudden drop in blood pressure. But sometimes fainting can be a sign of a more serious medical problem. Don't try to diagnose the person yourself just because they seem better. Instead, pay attention to what they experienced before, during, and after the fainting episode. If this was their first unexplained fainting episode, if it keeps happening, or if something about the episode seems unusual, encourage them to get medically assessed. So the next time someone suddenly faints in front of you, don't panic and don't rush to do everything at once. Remember the basics. Check if they respond, check their breathing, keep them safe, and get emergency help when necessary. And please don't slap them, pour water on them, or force food or drinks into their mouth while they were unconscious. Sometimes, knowing what to do in those first few moments can make a real difference. If you found this helpful, share it with someone you care about. You never know when this information might be needed. This is HealthVerse, bringing you simple health information that you can actually use in everyday life. Stay informed, stay safe, and I'll see you in my next video.